Hey, Eyes and Shine, and welcome to the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. Today, we get to hear from Dr. Jeffry Gerson. You may know Dr. Gerson as a frequent lecturer in the US and abroad. He writes regularly for optometric publications and does this all while still working in a collaborative OD-MD private practice with his emphasis on retinal care. In today's conversation, we dive into how Dr. Gerson not only found his love for retina, but also how he has been able to carve out such a career that includes activities like speaking or working with industry and doing clinical trials. Dr. Gerson is a wonderful speaker with a wealth of knowledge and really just a great guy to learn from. So if you give a damn about eye care like I do, then please listen in, because here we go with Dr. Jeffry Gerson. Well, thank you so much, Dr. Gerson. Jeff, you're the most early morning guest we've ever had on the podcast.
Wow.
So, thank you. Are you a heavy caffeine person? Do you drink coffee, tea?
No, I actually don't drink caffeine at all. I wish I liked coffee. I don't like it, but it's really good for you. So I wish I enjoyed it, but no.
Just because of the antioxidant polyphenol kind of route.
Exactly.
I think my concern with coffee, of course, and caffeine is like the blood vessel constriction. Even there's some publications on like retinal vasculature, although transient to some degree, it constricts even the choroid.
Yeah, what's interesting about coffee or anything else is you can kind of choose the literature that you want to believe and read, right? Because what I can tell you is there's also literature that tells you that people that drink coffee live longer, and the more coffee you drink, the better off you are. So, you can kind of play either side of it and take the pluses or the minuses.
With Well, thank you for, again, being here. It's always an honor to have such an esteemed guest who's known for speaking and going beyond just practice. For our guests, listeners who haven't had the privilege of meeting you, working beside you, or listening to you lecture, can you give us kind of your background? How did you even find optometry, and how did you get to where you are today?
Yeah, so I think starting with where I found optometry is kind of a fun story. So I remember when I was a kid, my family optometrist, and he happened to be a good friend of my dad. So he actually grew up with my dad. They went to college. They were in a fraternity together, and then ended up being an optometrist. And so that's who I saw as a kid as an optometrist. And from a pretty young age, I really kind of admired what he did. And so once I started getting old enough to think about, well, what do I want to do? I said, well, I want to be like Bobby. I want to be an optometrist. And then when I thought about why, I had some pretty solid reasons why, and maybe some that aren't so solid. I really thought I wanted to do something in the medical field, but I really don't like blood. And so that cuts out a lot of different things. Another big thing was I wanted to be somebody that people wanted to go to and would leave happy. And so for me, at least, that took out dentistry because I didn't like going to the dentist. So kind of narrowing down the fields, and it's also then keeps pointing to Bobby. And then I started looking at what he did. And I realized that he had pretty good hours. I kind of liked going to see him. And it didn't hurt that he always drove a fancy sports car. And so I kind of put all, it helps. So I put all those things together and thought, wow, this would be kind of cool. And, then fast forward 35, 40 years later, on Thursday of this week, it was right before the first lecture I was doing here at the meeting, and someone came and tapped me on the back. And I turned around, and it was Bobby. And so the guy, which was pretty cool, kind of a full circle thing, that the guy who really led me to optometry was then in the audience. He came to listen to me talk about optometry. Wow. So that was kind of a pretty cool thing for me.
Yeah, full circle. Does he know that he was that influential in you finding the profession?
Yeah, he knows, and I've talked about it before, that he really kind of influenced me from no effort of his own, just by being an optometrist and being himself, and which also then makes me think, can I have that effect? We can all have that effect on people. And one of the ways I think that manifests now is that in our practice we take fourth-year students, and just wanting to help create a great experience and education for them. But sometimes even more fun than that is having high school kids come, or college kids that say, I'm thinking about optometry, how do I find out more? And so my standard answer is come spend a day and see what you think. And if you like it, if you want to come spend another day, great. Now, there's some ulterior motive in that today, because then it's like, well, over the summer we could hire you because it's hard enough finding people to work for you.
Right.
If you can find someone that's motivated like that, it's great for everybody.
And I think that's something that I think a lot of other doctors I've talked with who have a passion and love for their profession do encourage people. And I had that experience with my local optometrist when I was growing up. Not only did my personal amazing experience with contact lenses automatically me just love seeing the eye doctor, but then when I started asking them, I'm like, wow, this seems like a really cool job. Tell me about how you found it. Tell me about, like, what is the lifestyle like? And they said, same thing. You should come shadow us. In fact, they didn't just encourage me to shadow them. They encouraged me to shadow an ophthalmologist. They encouraged me to shadow other healthcare professions because it's a different lifestyle.
Yeah.
Right. And I had a similar sort of experience. I didn't know I had trouble with blood until I shadowed. I saw a pediatric ophthalmologist do strabismus surgery, and I was doing okay in the OR. But as soon as blood came out, I passed out.
Oh wow.
And so I'm like, surgery's not for me. I don't think I'm gonna. Even if I went that route, I would hit that same. I just wouldn't be. I wouldn't be a good job. I wouldn't be a good surgeon.
Better to find that out earlier rather than later, right?
Exactly. So with kind of finding that passion for optometry, finding your route, where exactly do you practice now, and what kind of are your passions within optometry?
Yeah, so right now I'm in Kansas City, suburb of Kansas City called Leawood. The practice I'm in is a OD-MD practice, which is where I've spent probably the majority of my career in a collaborative practice like that, which I think affords me some different opportunities. And I've also been in private practice, just ODs. And so the different practice you're in, the different setting or modality, sometimes dictates not necessarily what you have to do, but what you get to do. And so I'm really lucky that I really get to do the things that I like, and I don't have to do the things that I don't like, which for me makes patient care so much more fun. Something I tell people all the time is I think you're really good at what you love, and you love what you're good at. And so if you kind of stick to that, you're going to do great. And so that's where I practice now, and so it's great because I get to do the stuff that I really enjoy, and I spend about half the time in clinical practice and half the time doing other optometry related stuff, which I find to be really fun, rewarding, and really just very fulfilling.
And I think we kind of spoke before starting the recording for the podcast here that's kind of one of your biggest things when it comes to, like, for other doctors and students to realize, right?
Yeah, it is, because I think, when we go to optometry school, like the story that you shared, the story I shared, I think anyone that goes to optometry school envisions, I'm going to go to optometry school, become a part of a clinic, and see patients 5 days a week. And for some people, that's exactly what they end up doing, and they love it. But I think what's really important to realize is there's so much more within optometry that we can do. And it's not that patient care is better, worse, and different. It's just that's part of optometry. But for some of us, doing things like working for industry companies, working for patient advocacy groups, things like that can be a really important, fulfilling part of what you do. And it's fun. I think it's a lot of fun.
It can, yeah. I think expanding beyond that horizon is important because I think everybody's got such different skill sets and interests and motivations. And while you may be inspired, and we spend so much time stressing, especially in school, of learning the groundwork of optometry, of the healthcare industry, and then really you have to, learning to take care of patients is difficult. There's a lot of things you have to master.
It is. It's really tough. It's really tough.
And then, your board tests and everything like that. And then maybe you practice for a few years and you realize this isn't maybe your absolute passion. You find yourself daydreaming of doing something else. So I think there is a lot for the industry, for optometry as a profession to allow doctors to really expand, and whether it be owning a business, going entrepreneurship in a different direction, whether it's in healthcare or not. I think you're right. There's so much more that it has to offer.
There is, but I think sometimes doing things outside of direct patient care actually affects more patients. And so, you think about, well, if I'm only seeing patients 3 days a week, then there's 2 days worth of not seeing patients or not helping people or something like that. But I think of it a little bit differently, in that when you find other things, other passions that you're doing within the industry, then you're still affecting patient care. You're still affecting and benefiting people. And quite frankly, sometimes in a far grander scale than what you could do as an individual in your office. Mm-hmm. So, even though some of the times I'm not in direct patient care, I think that there's things that we all do that still help people, right, and still fulfill our what we initially dreamed of doing when we wanted to go to optometry school. We're still doing that, but just in an indirect fashion.
Right. And I know for you, outside of patient care, how I first met you was through you giving CE lectures.
Yeah.
So you definitely help educate other doctors, right? And that kind of trickles down and makes them better and help their patient care.
Hopefully so.
Yeah, hopefully so, right? That's what we all hope. And then also, like, you work with industry in some regards. And so I love thinking that when I work with industry, I'm helping them improve their products and their services, which, again, helps lift and amplify the profession. With your experiences, like what what's your favorite zone to work with outside of just patient care?
Yeah, that's a great question. And if my wife were here, she'd probably be sitting and kind of laughing, because if somebody asked me at home, how many days a week do you work, or how often are you in clinic? And when I tell them, well, I'm in clinic 3 days a week, it sounds like, well, then you must not be very busy. And the truth, yeah. So you're snickering. So I think you would probably say the same thing. What happens is then you spend an inordinate amount of time doing other things, and it adds up to way more than 40 hours a week, even though I'm only seeing patients 3 days a week. And so, to answer your question, I guess one of my problems is I can't pick just one thing that I love so much, because I think there's a bunch of things that I really, really do love and enjoy doing. So I think if I were growing up today, someone would tell me I have ADHD and I'd be medicated, because I want to be in a bunch of different places. And my hardest thing is deciding which one to focus on. Mm-hmm. So I don't know that I can give you a great answer on which one thing, but because I enjoy doing all of it, whether it's continuing education, whether it's working for different industry companies. There's a nonprofit that I work with. I just find them all just to be rewarding and fun, and so it's hard to pick a favorite. It's kind of like if you have 3 or 4 kids, which one's your favorite kid?
Yeah, right. That's a tough. That is, and then maybe there isn't an answer. You love all of them,
right?
For being on that regards, as I know, because I haven't been practicing out of school for quite too long, but I remember a time when I was practicing and I realized, that I spend so much more interest in doing other things other than just patient care. For any of our listeners, viewers who are earlier on in their career, or maybe they've been practicing and they're thinking, I want to dabble in CE. I want to dabble in getting in an industry. Do you have any tips, recommendations? Because you went through that path of having to climb into how do I find this? How do I get into it? What kind of tips, recommendations would you have?
Yeah, I think the first thing is just do it. If there's something you want to do it. Make it happen. I remember a dinner I had with a couple colleagues, so 2 fellow optometrists that went to optometry school with. One was 1 year older, one was 2 years older. And after school, we happened to, the 3 of us, be living in Kansas City at the same time. And there were people that were lecturing a ton, and they were at every meeting, and and I saw that, like, that I think I want to do that. And so I remember going out to dinner with the 2 of them, and I asked them, like, guys, how'd you do this? How do you get to this point? And I very vividly remember them saying to me, just be careful what you wish for, because if you do something that you really enjoy and you're any good at it, people will ask you to do more of it. Mm-hmm. And then once they ask you to do more, someone else will ask you to do more. And so really it was, if there's something you want to do, find a way to make it happen, and then it'll happen more. So I think that number one is just follow your passion, and realize that, I think most of us, at least initially, create a little box that we're in as an optometrist. Mm-hmm. And that box actually isn't this. It's huge. It's a huge sphere of what you can be doing. So I think that's number one, is follow your passion. Number 2, I think, is ask people, find a mentor, and get help. because along the journey of the different things that I've done within optometry, I don't think I've ever gone to a fellow optometrist and say, hey, I think I want to do this. How do you do that? I've never had someone say, can't help you, or I won't help you. And so finding people that you admire, trust, and just asking for advice. And so for me, that's been tremendously helpful. You know, I can think in my head of a couple people that have been really influential, whether it's giving advice on what to do, what not to do, and following that. And so for me, it's really helped to shape the different aspects of my optometry life or sphere.
Right. And I think it just comes into how optometry is incredibly expansive as optometry is, how tight niche we are as a community, right? There's only so many of us, and I think there's even, there's only so many people with the personality and even the skill set to manage so many different things that go into what optometry is. And so I think it's great that you're right. I think all optometrists are willing to help and build and work together.
Yeah, if you talk to any industry people and you ask them about, what kind of job did you have before, where did you work, and how'd you get into optometry, those conversations always lead to them saying, well, optometrists are just nice people. It's a great field, and I love working in it. And I think that that's really true, that optometry is a great field, and optometrists generally are just nice people. Yeah. So, not take advantage in a negative way, but take advantage of that, right? And talk to people, and maybe find someone to help you find your passion.
Yeah. With speaking of passion, I know from just my experience, again, listening to you lecture, I know you are passionate about things like AMD, diabetes, a lot of retina stuff.
Yeah.
How did you even find that is your interest? What is it about it that really got you to draw into it and dive deeper?
Yeah, so I would say starting when I was fourth year extern, and there was one particular rotation site that I had where I really kind of connected with the mentor there, and his thing was retina, and I just started kind of getting into it, enjoying it. And then, like you, I did a VA residency, and 2/3 of our day was macular degeneration, diabetes, and glaucoma. And then there'd be the third of the day that was other kind of random stuff, but at least 2/3 of it were those things. And so I just realized what a big deal that was, and then realized that there was, at least at that time, so many optometrists that weren't comfortable with that. And just thinking, well, this is something that we can be comfortable with in helping our patients and taking better care of them. So I think that's kind of what started it. And as I've done more and kind of dug in, it's just kind of that passion of that's become more and more and more. And also somewhat self-serving. Luckily, at that time, 25 years ago, there weren't many optometrists talking about retina stuff, AMD or diabetes, diabetic retinopathy. And so when those two mentors said, just do it, I also kind of realized an opportunity. And that, well, this is an area where I think as a profession we're kind of lacking in education. So it's something that I dove into to try to become maybe a little more knowledgeable than somebody else, and to be able to talk about and to be able. And then from there, it just kind of snowballed and things kept on rolling.
Why do you think that a lot of optometrists, maybe back in the day or even still in our current practice, why do you think some optometrists maybe are shy away from diving deep into retina or any things like AMD?
Yeah, I think because it might be scary, right? Because refraction is important, but if you're off by a quarter diopter, half diopter, it's going to be okay, right? I mean, there may be a remake involved, so it may cost a little bit, but everything's going to work out and be okay. But I think if you're talking about something like macular degeneration or diabetic macular edema or some of these retina things, I think that most people's perception is that the same small mistake there can or will have grave consequences. So I don't want to be responsible for that mistake. And I think for anything that you're not comfortable in, I think it's a good attitude to have. But it's something that, well, if you become comfortable with it, then you don't have to have that attitude towards it. And if you're comfortable with it, then it becomes a natural, normal, everyday part of your practice. And so it kind of goes back to, I think you're good at what you love and you love what you're good at. And I'll give you an example for me. I don't like dealing with double vision. And so when we have students, fourth year students, one of the things that on their first day, when I'm kind of giving them introduction and kind of getting them up to speed on how things go, one of the things I tell them is, okay, if somebody comes in with double vision, first thing you do is talk them out of it. And they give me a look like, what do you mean? So I'll have them cover one eye. If it's still there, it's not double vision. Is it ghosting? That's astigmatism. It's not double vision. If they blink and it goes away, that's dry. It's not double vision. So most of the time, you can make double vision go away. If you can't make it go away, then step 2 is you fix it. Number 3, if you still can't make it go away, find one of the colleagues in the office, because that's not something I'm good at. And so lucky because of where I practice that I'm kind of able to do that and do the things that I love and not end up doing the things that I don't love and that I'm not really good at.
Right. And I think, so my experience with double vision was when I was doing my residency, the ophthalmology department at the VA did not touch double vision. As soon as there was a double vision patient, it got sent to optometry, and as the resident, that was my
your job.
Yeah. So, and of course, you're on a time crunch, as we all are in busy clinics. And I had to kind of, was it trial by fire sort of thing? I had to learn that. And so I think double vision can be caused by certainly severe consequences, things, like neurological issues. And you have to be able to fix that. But a lot of times, especially in older individuals, it could just be, due to muscle changes.
Yeah.
And changes due to cataracts and their ability to control their accommodation and convergence. So I thankfully got really used to that, but still, it's still something I wouldn't say I love, right? Speaking about passions.
Yeah.
But for some binocular vision docs, they're like, yeah, send them my way.
Which is
that's
great.
What they want to touch.
Which is great, right? I mean, I think that's fantastic. But that kind of goes back to why I really dive so headfirst into retina stuff, to AMD and diabetes, because it's something I do enjoy.
Yep.
And I think something that as a profession we don't do a good enough job of is utilizing our colleagues. And if someone's, if you're not comfortable with something, find another OD that is. If you are comfortable with something, let someone else know, hey, this is something that I enjoy and I think I might be pretty good at. Feel free to send your patients to me for that. And so I think that's another thing that we can all do better.
Right.
But again, that's kind of going back to, I found something that I thought was important, that I liked and I wanted to do. And I think the other thing, fast forward to today, is I really realized how much there is that we can do for our patients with diabetes and our patients with AMD, and that there's so much opportunity. Those aren't just diseases that need to be at an ophthalmology office or at a retina specialist office. Most of them don't. Most of them are just as well or probably better served in our offices, where we may be able to spend a little more time and talk to them, educate them a little bit more. And so that's become something that I just really enjoy doing.
I know with like macular degeneration, I know some doctors who, as soon as they see one small drusen near the central macula, that triggers them, and despite what diagnosing kind of pattern you have, they see one drusen and instantly that's like, we go into full mode of like, you're at risk for AMD, this is lifestyle factors, these are what we need to do. And then I know other doctors, they see that and they just like, whatever.
Yeah.
And it's kind of fascinating, because I think once doctors start seeing large drusen, they start seeing many drusen or pigment changes, certainly they act more, they're a little bit more aggressive in that regard. But when it's just that early beginning, right, tip of the iceberg sort of thing, I think it can be a little bit of a gray zone for a lot of doctors.
It can, but the analogy I make is, and I say this sometimes in talks, if you have a patient with pre-parametric glaucoma, is that somebody that you say, let's do something about it? Or is that somebody that you say, let's wait till it gets worse enough to do something about it? And most people would say, well, I'm going to do something about it, right? Or the other analogy I give in glaucoma is, do you wait for someone to lose enough visual field that it's starting to affect their fixation? Well, no, of course not. You do something before then. And so what I really believe is that if you wait for someone to have AMD that's bad enough, that's the same thing as saying, well, let's wait till your fixation is threatened from glaucoma. And so I think the important thing isn't when you act, because to me that's very clear. You act as soon as you see any signs of macular degeneration. The important thing is, how do you act? And specifically, how do you relay that to a patient? Because I think the people that see something that kind of downplay it, the reason likely is not because they don't find it to be medically significant. The reason is likely because I don't want to have to talk to my patient about this, because I don't want to upset them, because optometrists are nice people. And so the way I see it is when you have something really early, then I get to tell my patient that they have macular degeneration. Whereas if it's later on in the process, then I have to.
Right.
And it's a totally different conversation. It's a different vibe. And patients leave with a totally different perception in their mind of what's happening or what's going to happen. Mm-hmm. So, I embrace the early disease and the opportunity to talk about it, educate, give some potential, not solutions, but things that they can do to be more preventative. And even in the later cases, something that's interesting about macular degeneration, there's been some great studies, right? And even if we just look at something like AREDS and AREDS 2 that tell us what to do at a certain stage of macular degeneration, there's surveys that show that 2/3 of people that have intermediate dry AMD, they're not on the right supplement. Mm-hmm. And so it's huge opportunity to just make a little change to potentially create tremendous benefit for your patient.
And I think lifestyle factors is a major discussion that I personally am fascinated by that. So I try to really encourage a lot of my patients to think more about just what they're doing to take care of their overall health.
Yeah.
Certainly smoking is the big one. Thankfully, we don't see, at least here in the United States, I know the smoking rates have dropped dramatically over the last 20, 30 years. So most of my patients don't even have a history of smoking, and they're confused that I bring that up. And it's just like, well, it is a big issue.
But for the ones that do, it's a tough conversation.
Yeah.
I had a patient this week, a new patient to me, and has AMD, so we were talking about that. And the way I started the conversation with him was similar to anyone else with AMD. I tell him there's 5 things we're going to talk about. 4 of them are the same as what you've heard from every other doctor you've been to in the last 10 years. And I said, you want to guess at what some of those might be? And he said, probably smoking. And I said, yeah, but I'm going to guess just by the way we're talking that you're not really interested in quitting smoking. And he said, I'm not going to quit smoking until cigarettes cost $280 a pack. If they get up to $280, then I'll quit smoking. But you're right; it's like the most important thing. But some people, it's like the most addictive chemical that we know of, right? And I come from a family that I've lost 3 grandparents from lung cancer, and my father smoked until his doctor showed him a permanent black spot on his lung, and so I understand it. Yeah,
I know for my patients, I just tell them, look, you've heard this, that's not good for you. I just tell them, how can I be a better advocate for you? How can I better help you? Have you been, are you struggling? Have you tried quitting?
Yeah.
If you haven't tried, or if you have, you're struggling, let me know. I'll get you as many resources as I can, whether it be gum, patches, I'll send you for therapy, whatever we can do.
But I think you just pointed out that it's a great opportunity because someone that smokes has heard it a dozen other times, but they may not have cared about the messaging or the potential end result. And so I never go so far as to say, if you keep smoking, you're going to go blind. I don't use scare tactics with patients. I don't think it works. But I at least let them know that the smoking could potentially affect their vision. And for some people, that's what they need to hear. And they become more interested in potentially trying to quit smoking. Maybe it helps sometimes, maybe it doesn't. But for some people, vision is their major motivator.
With you mentioned, like with supplementation, like some of the research is starting to say that some people aren't on the right supplement. I'm curious I don't mean to put you on the spot, but off the top of your head, can you kind of expand, tell us a little bit more about what you've learned in terms of supplementation? Yeah,
so what I was referring to specifically was there was a survey of intermediate AMD patients and their doctors and finding out what are they on. And so about 1/3 were on nothing. 1/3 were taking a multivitamin or some sort of eye vitamin, but not an AREDS 2 product. Okay. And only 1/3 were taking an AREDS 2 product. So 1/3 were on the right thing, 2/3 not. And, whose fault is that? It's not necessarily someone's fault. Did a doctor explain it to a patient, make a recommendation? Did a patient not hear it? Was it too expensive so they didn't end up buying it? And we don't know. But either way, whatever the situation is, that's an opportunity for us. I think nutrition, and you mentioned, talking about foods, and earlier we were talking about Mediterranean diet and things like that. I mean, that's the ideal thing to talk about, but for most people, that's not a reality that they'll undertake. And so in an ideal world, we wouldn't need supplements, we wouldn't need the vitamins. But in our current world, in our standard American diet, patients need that. So start talking about supplementation as soon as we start talking about macular degeneration. For me, the two go hand in hand. That there's no reason for someone with any stage of AMD not to be taking some sort of supplement.
I know, just in that same kind of realm of diet supplementation, it's very difficult sometimes to have that conversation and even help people understand what Mediterranean diet means, because I know for a lot of even my life, I'm like, Mediterranean diet, well, Italy's in the Mediterranean.
Right. Pasta, pizza, and wine.
I'll go get a Chicago deep dish meat lovers pizza, and just nothing but cheese, saturated fats, and massive amount of calories, and it's like that's how we grew up all our lives, is eating that. So what's wrong with that? It's just, it's not the same thing.
No.
So it's. And then the supplementation world, you're right, it gets confusing. I'm already taking a multivitamin.
Right.
Well, this is a specific mix of vitamins just for the eyes that have been researched and shown to help with your condition.
I think like anything else, it's make it simple. Mm-hmm. For me, with any patient messaging, when I'm doing talks, and sometimes when I'm talking about diabetes and some of the things I talk about with my patients, or talking, hey, this is what I talk to my AMD patients about. People are like, well, how do you do that in clinical practice? You only see like 4 people a day. And I'll say, no, in a half day, I'll usually see around 20, which is a pretty hefty schedule. So how do you talk about this stuff? So my answer is I come up with like a one-liner for everything. And I really think that helps, and it's what we need to do. Simplify your messaging down to like one line. And then if your patient wants more, have 2 or 3 more you can give them. If they want more than that, then we need to have resources to direct them to. Mm-hmm. And so, for the diet one, so my one-liner for diet is try to have a healthier diet with more green leafy vegetables, less refined carbohydrates. And that's it. And, well, gosh, what do you mean, or how do I find out about that? Well, probably the ideal diet would be a Mediterranean diet, which includes those things I talked about, plus some oily fish. Here, there's some great books on it, or you can go Google what's a Mediterranean diet. Mm-hmm. And that's about as far as I'll go, because I don't have time. They're not going to process more than that, and they're just going to go to Google afterwards anyways. Yeah. So I really believe one line for everything. So lifestyle, exercise. So I don't tell people to go exercise. My one-liner for that is try to be more active. You don't need to pump iron or run marathons. Just do something. And that's it. And if someone asks, well, what kind of exercise? I don't know the answer to that. Just do something. Go for a walk. Even going for a walk a block a day cuts your risk of developing advanced AMD by 50%. Really? Just a block a day? Yeah. Yeah. So you don't have to do a lot. Just do something. So that's always my message to patients is, simple packages that they can digest.
I know that reminds me for a lot of my patients with diabetes. I try to encourage them that same thing, just being more active. Even telling them, getting more active, just even going for a walk has been found to be just as effective, if not more effective, than taking metformin.
Right. Twice as effective.
Yeah. So I'm just like, that's going to be really important for you to make a significant life change, your longevity, your risk for heart disease, everything. Just making this one change.
Yeah.
And I think as a primary eye care providers, as primary care drivers, this is an important thing that we should almost be including, even in routine exams, having some kind of comment about lifestyle changes that can better improve not just their eye health, but everything.
Yeah. I think a lot of times we get stuck, I mentioned this before, in the box. Mm-hmm. And that we're looking at eyes and how are your eyes, and that's okay, then that's it. But I think a lot of times what I'll explain to my patients with diabetes is, the reason we do this, and we're doing the exam today and everything that we're doing, the reason your doctor wanted you here is because checking your vision, how we're doing it now, is how's your vision today? Mm-hmm. But protecting your health and eye health is protecting your vision for tomorrow. And that it doesn't matter what your vision is today if it's not going to be good tomorrow. And so talking about, with our patients with diabetes, as you mentioned, what's your A1C? Or more importantly is what's your time in range? Are you using a continuous glucose monitor? And bringing those things up. And a lot of times I think people think, well, we're optometrists. Should we really be asking them about continuous glucose monitors? And the answer is absolutely yes, because studies show that if you have a better time in range with your continuous glucose monitor, you can dramatically decrease the risk of developing or having worsening of your retinopathy. So it directly correlates. So it's really not outside the box, it's just make a bigger box.
Just a little bit bigger. I know with all that you do in terms of retina, AMD, diabetes, you volunteer for some organizations. Can you tell us a little bit more, like how exactly you're involved with?
Yeah. So I think wherever you live, whatever your passion is, whatever you do, it's important to give back in one fashion or another. So interestingly, we're doing this from Vision Expo West in Las Vegas, and last night my wife was at a charity event that she and I were the co-hosts for. I was obviously here, not there, because this was this trip, this interview, this was all planned before that event was, so I wasn't able to be there. But so that, for example, is an organization that deals with people with addictions. So whether it's substance use disorder or something else. And that one's more kind of on behalf of my wife being really interested and involved, and us being involved together. But just being a part of organizations like that, other community organizations. I've done some volunteer work within our industry. Probably one of the other most shaping events or things that I've done, even really in life, is going on a couple eye care missions. So in school, I went on 2 VASH missions. After school, I've only been on 1, but I went to Romania on a mission. And man, I think that's the coolest thing you can do. And I would tell anyone that hasn't that you're missing just such a tremendous opportunity just to open your eyes, to see what's out there. Now, I guess you could be criticized and say, well, you should go on a mission, because there's plenty of work we can do at home. And so one of the things that I started really early in my practice was, so my family and I are Jewish, so we don't celebrate Christmas. So Christmas Day, a day off, was a day that, great to have a day off, but I don't mind working. And so started a program where I reached out to some social service agencies and said, hey, for Christmas Day, find me 10 people to see. I'll do an eye exam, I'll give them a free pair of glasses. The hitch is they got to come in on Christmas Day. And for 10, 12 years, it was great. It became a little harder actually to get agencies to help me find the patients. I haven't done it the last couple of years. But it was just, something that, why not do that? I don't mind working, and it was something that could be giving back. And
it's pretty creative too.
Yeah. It was just, like I said, my attitude was, well, I don't mind going in. And I'd find a couple friends and I'd say, okay, can you come help me do this? And they'd be like, well, I don't know anything about optometry. I'd say, well, all you got to do is have someone sit in front of this instrument and have them look straight ahead and press a button. So I had someone help me do autorefractions and some other stuff. And so it became kind of fun it made a day of it. And it was kind of a cool thing.
I think it's also, it's inspiring that how you and your wife contribute to these missions that you guys prioritize, things that you guys really care and have a passion about. And you guys are able to even kind of feel that together. And I think just even as a broader scope of our profession, there's so many topics that we do care about and ways we can band together, and it also strengthens us as a community.
Yeah, it does. And there's so many easy ways to do things and give back. I'll tell you another, I think, kind of creative thing that I'm doing with a colleague. So a colleague that I do a fair amount of lectures with, his name is Paul Chouse, and who also has been very influential in a lot of things I do and why I became so passionate about diabetes. But he and I have a virtual talk that we have coming up, and it's for Hawaii. And what Paul and I decided, I don't know when this is airing, so maybe it'll be after we've already done this. What we've decided is we want to donate our honorarium towards a charity in Maui. But we're not just going to give the money. What we're going to do is we're going to get organizations to match. So we're going to tell the optometrists that come on for the first $1,500 that gets donated, we're going to match it. Plus hopefully we'll have X, Y, and Z companies or organizations also set up to match. That's pretty easy to do.
That's amazing, and thank you guys for doing that. And I imagine that's just because of the fires and issues we've had.
Right.
Which is all very devastating and tough to hear that. And there's so many different causes. I think people can kind of think of how they could apply that same kind of strategy.
Yeah, and it doesn't have to be money, though. I mean, we're really fortunate in what we do that we have a service we can provide. And by the way, if you provide that service and you want to be able to provide glasses, there are plenty of industry partners that are happy to give you frames and do lenses. And so it becomes really easy. So, someone that's first year out of school that says, I got a bunch of debt, I don't have any extra money, how could I do it? Donate an exam a month, right? Have someone help find someone that can't afford an eye exam. Just do it once a month.
Right.
And then go to your lab and go to a frame vendor. Can you just once a month help me get a pair of glasses for someone? No one's going to tell you no.
Yeah. Well, Jeff, thank you so much for being here. You're clearly somebody who gives a damn about your profession and what you do with a high level of excellence, right? One big question that I've been loving to ask all of our guests now is, if you somehow were elected the next day to be kind of this Surgeon General of optometry, right? You got to kind of be the leader to make a decision for like the next year. If you could snap your fingers and change one thing about the profession to make it better, what would you say you would do? What's something that you would really want to see change for the better for optometry?
Yeah, I think it kind of goes back to something we were talking about before. I think what I would tell fellow optometrists is find what you really enjoy doing and do it. And for the things that you don't, find someone else to do it. Because, a big thing in medicine right now that you read about, that you hear about, is burnout. And I'm really convinced that a big part of burnout isn't just the amount of time you do something, it's what you're doing. So I think we all have that opportunity to find what we really enjoy and do that. And the stuff that you don't, find a way that you don't have to, or that you don't have to do as much. So, again, it's find what you love, and you're going to be really good at it. You'll be happy doing it. And so that's what I would encourage people to do.
I appreciate that so much. Thank you, Jeff, for being here and being a guest on our podcast. Safe travels home. And
Thank you.
We'll hopefully be able to have you on again in the future.
Would love it. Thank you for having me. Appreciate it.
So that was our discussion for today. Thank you so much for tuning in. If you have not done so already, please like, subscribe, and follow the I Give a Damn podcast, either on YouTube or over on your favorite podcasting platform. Same thing if you have any comments, suggestions for topics, or you'd like to nominate a guest to be on the podcast, then please let us know in the comments. Otherwise, again, thank you so much for listening in, and I hope you have a fantastic